Hey guys, I've gotten a lot of questions about how I have approached insurance. My last post was really not a pity party. It was, I have the opportunity to choose where my family gets their health care. I can pay more money or less money. I can go to a high quality place. I can go to a low quality place. And so I just wanted to run through that really quick with you on my decision. And now it's a little bit interesting, but stay with me. I promise it will help you think about insurance. So in 2016, my insurance premiums, Blue Cross Blue Shield, were going to go up to $1,800 a month for a family of five, and we're all healthy. My wife and I were under 40 years old. My kids are younger, three kids, two boys and a girl, and we just felt that was excessive. So what we did is we started doing some calculations, and we said, okay, for $1,800 a month, our exposure per year just in premiums is $21,600 a year. Plus, because we're, paying this, we have the opportunity to pay $500 in deductible out of pocket plus copays. So our minimum exposure is $26,500 a month or a year. And we just felt like that was excessive. So we looked into options and we just did crunch some numbers, basic math. We ended up going with a healthcare share ministry that had a $10,000 deductible, or they call it they don't call it a deductible, but a household sharing. And then, so that left our exposure at $13,000, so nearly half that. But we had to pay cash for all our preventive care. Well, not a big deal. We spend $1,800 a year for what's called direct primary care. It's a concierge doctor. We have 24/7 access to this doctor. They're not governed by the government or by HIPAA. They truly care about the patient. In fact, they have no administrative staff. Either the doctor or her nurse answers the phone. So annually, on just premiums alone, we're saving $18,600. What we did is we took that spread and we put it into a savings account, and we built that savings account up to $25,000. Definitely covers our exposure here and here in case things go sideways. And then we felt like we were ready to go. So now, 3 years later, we have a savings. If we would have continued, and we all know those premiums went up to $64,800 of savings, but we went ahead and took out our Medishare costs plus our costs for the direct care doctor, $50,400 that goes straight to the bottom line that we could save or spend on other things. That is incredible. So let me give you just an example of how this has worked. My son, a couple years ago, had a broken arm. We went to the direct primary care doctor, and she ordered an x-ray. We paid cash for the x-ray, $40. We paid cash for the specialist orthopedic doctor, $250. We paid $150 for the cast, for a total of $440. And then we continued following up with our direct primary care doctor. And this specialist cash visit also included a follow-up just to make sure everything was healed. That same broken arm actually would have cost us about $2,500, plus the insurance would have paid another $1,000. So there's a $3,000 spread. That's just crazy. Well, I've also gotten a lot of comments that, hey, the government is the answer to take care of healthcare, and that is not true. And I'm just going to do some basic math. This is just basic math. This is not my income, but let's just suppose it is. Let's say I make $80,000 a year. $80,000, and then if you've got some the tax write-offs and that sort of thing, you really end up paying about 25% in taxes, which would be about $20,000 a year. Let's just say I live in another country that says, oh, you get free health care, but we're going to take 50% of your money. So that's $40,000. What about 60% of your money for some of these countries, but you get free health care and all this other stuff? Hey, nothing's free. I'm not letting anybody take 60% of my income. So then you take away about 5,000 a year for the way we have it set up, the MediShare. Plus, we already have $25,000 in savings. So that's a $15,000 annual in my pocket money that I can have. I'd rather have the $15,000. I don't need free health care. I want $15,000. So the government is not the answer. Cash is the answer. Why don't we, like anything else, take control of our own healthcare things? We can choose how much we pay. We can choose where we go. And that's really what this is about. My wife and I, we feel like we have the most freedom we've ever had in choosing healthcare for our family. Yes, it's not necessarily the most convenient thing, but anytime you have this in your healthcare, it's never convenient. There's a reason why people come to something like the Oklahoma Surgery Center or come even to the U.S. for their medical care. It's true, we still have some of the best medical care in the world. My wife and I just feel like cash is the answer. If you're smart about it, you can take care of yourself. And so I hope this stirs some thoughts. Please comment below. Let me know what you think.